moving on, I said I was going to talk about COVID, and I actually thought it would be a really useful way to help you understand the challenges facing the trans community, to actually talk about how the virus is impacting the trans community right at this very moment. Now, I know that the virus is impacting absolutely everybody. It's an unprecedented, I know that's such a cliche word, um, situation, and I guess that everybody who is watching this video is holding all kinds of fears and worries and frustrations and a whole bunch of other things about the virus. The reason I wanted to specifically talk about the trans community is because sometimes having other differences in the mix can complicate people's experience of something even as universal as COVID. So I'm going to talk a little bit about how that might happen, and it might help us focus on some of the differences the trans community are experiencing, your trans staff, your trans students, that might lead us to thinking about how to include trans people better in our spaces. So the first thing I wanted to talk about is estrangement and isolation. I think this is particularly true for trans students, that it is still the case that I think probably most trans people in the beginnings of their trans journeys will start to experience friction with family members, often the close family members the most. I see a lot of parental rejection, estrangement, or just parental struggling, not understanding, or often parental sort of efforts to try and control the trans person not to be trans by being disapproving or non-accepting, in the hopes that maybe the transness will just go away. So what this means for a lot of trans people is that they've lost their family support at a time like this, where trans people are being expected or students in general are being expected to go back to their families because of social distancing and isolation. They might not be going back to a safe place in their families. They might be actually unsafe in their homes or estranged from their families. So this can obviously complicate things for them. It also means that their support networks might be more tenuous. And this is also true. I hear a lot of stories when I train in universities of trans students not being accepted in their housing situations within halls. A lot of the cheaper accommodation in halls is same-sex accommodation, and there's often a lot of rejection of trans women in or women halls, or trans men in all male halls, and often mixed accommodation is actually more expensive, and trans people tend to be at the lower end of the economic rung as well. So that is another complication that we have, where people might not have support networks, they might not have community around them, they might not have people looking out for them if they get sick, they're isolated, they might not have people bringing them shopping, checking in with them, they might not have people to reach out to if their mental health gets poor. So I'm seeing things like, trans people taking less care of themselves around this virus because they don't value themselves, because their mental health is poor, because they haven't got their usual mental health support systems in place, because NHS services are obviously being channeled into support around COVID, and so the normal services like mental health support are falling by the wayside. I'm also seeing people worrying about access to their medical treatments. All trans surgeries have now been cancelled, so people who've been waiting, and often the waiting list for trans surgery is many years, particularly at the moment, 3 years just to see a gender clinician. To get surgery usually is going to be another 2, so minimum 5-year wait that most trans people have had before they can medically transition, if that's what they want to do. And certainly all of those surgeries have been cancelled because of the virus. So a lot of trans people have been waiting for a very long time for a treatment that, let's be really clear, is often life-saving. The experience that trans people have with their bodies can be so painful that it can put them in danger. So actually not having access to medical treatment at this time is causing, is putting trans people at risk. I'm not saying it doesn't have to be that way, but it is, and I know that there are many other medical issues that are being falling by the wayside because this is just such a huge crisis. But that's the sort of complication that some trans people might be experiencing. We see trans people being at a higher risk of domestic violence and hate crime and harassment. How that sort of impacts in COVID is, if you are somebody who is on lockdown in a domestic situation where you're with somebody violent, then obviously that puts you at higher risk. 80% of trans people have experienced domestic violence at some point. They experience domestic violence at a much higher rate than the rest of the population, and one of the reasons for that is because of the general mistreatment of the population. It's very easy for an abuser to keep a trans person in a relationship. It's harder for them to flee. It's harder to seek services. Might reject them because of their trans status, or might not be culturally competent. So there's all sorts of complicating reasons. Police might not be supportive. Many reasons why trans people might not get the support that they need to flee a violent situation. So people being locked down, they might be experiencing harassment from neighbours. They might not be experiencing support from neighbours. There's also a huge upsurge in online bullying at the moment. Considerable amount of not very nice people with a lot of time on their hands and not very happy. So online bullying in general is going up, but we're seeing particularly trans people targeted, and the media for the last couple of years have been severely scapegoating the trans population anyway. So we're seeing a real upswell in attacks on trans people. Public figures denouncing trans people's civil rights, and sort of general kind of negativity towards trans people, scapegoating of trans people, and stories being told about the trans community that are very inaccurate, but have been retold and retold so many times. They're beginning to feel true to some people because they've heard them so many times. So misinformation about what civil rights trans people have, what civil rights trans people want, what that would mean for other people, that sort of thing. So that's a complicating factor with COVID. Everybody's seeking support on social media and wanting to feel safe online, because that's really the only space we have left to socialise. And for trans people, the online space, often people tell trans people, well, just don't go online because obviously it's, there are bullies on there, and now online is the only place for us, and it's feeling increasingly unsafe. So that's really difficult. Okay. There's also, as well as, and there's a higher degree of mental health, there's a suicidality within the trans community. Around 48% of trans people have attempted suicide. We see that right across the board. In America, UK, India, it's a fairly static figure. There's very robust research that shows that the suicidality of trans people goes down if they have access to certain things: fair treatment by society, legal recognition, and trans healthcare if they need it. So we know now, and the reason the World Health Organization has declassified gender dysphoria as a mental health issue, is that actually trans people's mental health is contingent on society and how they're treated. It's not an intrinsic problem. But there is a huge mental health problem with our community because of the way society treats us because of lack of civil rights, lack of access to healthcare. This basically means that we've got a lot of suicidal trans people. We have a lot of trans people who are in need of healthcare services that they're not really getting at the moment. We have trans people who are in desperate need of support systems, because we know that support systems mitigate suicidality and mental health issues. And actually what you can do by being culturally competent and aware and having good systems in place and protocols and policy make a massive difference to trans people's mental health. The other thing is that there is a known correlation between neurodiversity and trans people. I want to be really clear that I'm not saying that autism or neurodiversity in general causes transness, or that transness causes autism, but the two things tend to co-occur in the population. It's also true that left-handedness also co-occurs in this cluster of people. So, you know, if you're left-handed, you're more likely to be trans, you're more likely to be gay, you're more likely to be autistic. Nobody thinks that left-handedness causes gayness or autism or transness, but they do co-occur. It's the same thing with neurodiversity and transness. It's the same thing with certain other issues, and particularly things like Ehlers-Danlos syndrome, which is a connective tissue disorder. So we also see a high level of disability. So we've got a vulnerable population, we've got a physically more likely to be disabled population, we've got a higher incidence of things like asthma and other issues as well. So we've got much more of our community being told by the government to isolate for 12 weeks. And we've got much more vulnerable people. We've got a lot of wheelchair users, a lot of disabled people in our community, all very, very vulnerable people. With complicating issues, and neurodiversity being one of them. Neurodiversity means that, for instance, the communication that's coming out of the government isn't always brilliantly well worded, and we've got a lot of worried people not understanding what it is they're exactly supposed to be doing, getting texts that they don't understand from the government, and that adds to the problem. So clear communication and an awareness of neurodiversity can make a massive difference to my community. I generally assume that if I meet a trans person, they might well be neurodivergent as well as trans. And I find that's a really good rule of thumb, actually, to treat a trans person as if they might be neurodivergent, and to assume that any kind of quirks or idiosyncrasies or differences might be neurodiversity. It can really help expel a lot of bias around trans people as well, because actually we tend to see people saying things like, oh, that person doesn't take turns in conversations very well, or they talk too loud. That's probably because they used to be a man, and actually it's, you know, trans women didn't used to be men, they were always trans women, and it might be that their mannerisms are to do with neurodiversity, not to do with maleness. Okay, and then the final thing is that an awful lot of trans guys and non-binary people who are assigned female at birth and have breasts that they are uncomfortable with might be chest binding, and obviously with a serious respiratory illness, chest binding imposes a lot of risks. But it is also true that chest binding might, you know, sort of cause respiratory problems if it's not done safely. So there are also safety issues around some of the things that trans people are doing over long periods of time in order to try and mitigate their gender dysphoria, and that can add another complication. Whew. So can you see there's quite a lot going on for our community that then impacts on something like COVID coming along. Obviously this is a huge thing for everybody, and I don't want to say, oh, you know, trans people have it so much worse than everybody else, because I'm sure that, you know, we could have the same list for you know, or not the same list, but a similar kind of approach if we were talking about our students of colour, or sex workers or migrants or homeless people. So any marginalised group is going to have these extra impacts. But I'm hoping that talking about COVID in relation to the trans community might have given us a little bit of a picture of how the trans community's experiences complicate their learning, their journey through university, their experience as staff members. Every experience a trans person has, they are bringing their transness into that, and that's going to make a difference to what's going to happen in that experience.